Welcome to Insight Strategies. Jody Talks Politics. This webinar will be posted to my YouTube channel. So, for instance, last week I interviewed Anne Ruston, and so the full interview of my interview with Anne Ruston is available on the YouTube channel, as are some key snippets and takeouts from my discussion with Anne Ruston from last week. And I'll be doing a similar thing here with Mike once the full interview has been done, and we'll get it posted in the next couple of days. Please feel free to have a look at, as I said, whether it's last week's interview or will be this week's interview. And also please feel free to subscribe to my channel, as there's lots of other posts from Jody Talks Politics where I talk about other issues as well. But obviously today's will be focusing on health, and is very timely, as I said, given the discussion that we had last week with Shadow Minister for Health, Anne Ruston. Dr. Mike, good afternoon.
How are you?
Yeah, I'm good. Thanks very much. And thank you very much for joining us all. So look, for those that may not know Dr. Mike, and I'm sure there are many here that have had their own interactions with Dr. Mike, but for those that may have not, I'll just give a very brief bio and background of Dr. Mike. So before entering Parliament, Dr. Freelander enjoyed and continues, I assume, Dr. Mike, a distinguished career as a paediatrician, spanning more than 4 decades caring for children and families across southwest Sydney. His extensive clinical experience has given him first-hand insight into the challenges facing Australia's healthcare system and the importance of ensuring patients have access to high-quality care. Since being elected to the Parliament in 2016, Dr. Freelander has been a strong advocate for strengthening Medicare, improving access to innovative medications, investing in preventative health and supporting Australia's health workforce. Importantly, he serves as the chair of the House of Representatives Standing Committee on Health, Aged Care and Sport, overseeing parliamentary inquiries into some of the nation's most significant health and aged care issues. In this role, he works closely with key stakeholders to examine reforms that will shape the future of our healthcare system. Dr. Freelander's unique combination of frontline clinical expertise and senior parliamentary leadership makes him one of Australia's most influential contributors to the national policy debate. Before we kick off with Dr. Mike, can I ask, please submit any questions you have to the Q&A chat box. Welcome to everybody for joining, and in particularly to your good self, Dr. Mike, and thank you again. Kicking off, Mike, you've certainly been at the forefront of some interesting debates, more so in recent times. I'll start with a quote and then we'll get into some questions. You said recently, "We are reaching a point where we do need to make some changes to bring the system more in line with the 21st century. In light of that, and you being one of the Parliament's strongest advocates for improving access to new medications, is the current PBS keeping pace with medical innovation, or does it need fundamental reform? And if so, what needs to change in your opinion?"
Well, thanks for having me on, Jody. Look, they're really important questions. I think we all treasure the PBS system, and it's had lots of evolution since it was started in 1949. By the Chifley government. I think there's no question that the pace of change in medicine has picked up in the last decade, and we do need to improve our systems and bring the entire system up to date. And it is slowly adapting, but I think the pace of change at the moment demands that we act in a more robust and more timely manner, and I think there's general agreement on that. And as you know, the report that Trent Zimmerman and I did for the government when we were in opposition and the Liberal National Party were in government is now quite old. It's 5 years old, almost, and I think there's no doubt that the pace of change could be quicker, and that's my view, and I've not made any secret of that. But I would say that it is very important that we maintain overall the model of a universal provider with the PBS system, and that we make modifications around that.
Look, it's a really good point you make, Dr. Mike. Do you think on balance we still have a universal healthcare system with issues like, and I know you've got another important inquiry, you're actually looking at specialist medical fees. Do you think our system still can be considered a universal healthcare access system?
I think it's a bit like the curate's egg. It's good in parts, but there are some signs of fraying at the edges, and particularly when we look at health equity. Delivering 21st century care to all areas of Australia and all sections of the Australian population is increasingly difficult. And the government's done a lot of really good things in improving access to the Medicare system, particularly fully bulk billed GP visits has been great. Some of the work we've done in providing innovative medicines for some of the disorders that I'm very interested in, the genetic disorders of childhood, cystic fibrosis, neurological disorders, etc., has been really good and really important. And I think few countries around the world have been able to provide that access that we have. But we are seeing people in rural and regional areas struggling to get access to higher level specialist care. We're seeing longer and longer waiting lists in our public hospital systems. We're seeing a really, I would say, a degradation of our public hospital outpatient system with fewer and fewer clinics, longer and longer waiting times. And I think gap fees to see specialists in particular are reaching levels where many people just can't afford it and are missing out on care. So there are lots of good things about our health system, and I've examined health systems around the world. We do provide pretty good costings for our higher level care. You know, we spend probably around 12% of our GDP on healthcare. Some countries like the United States are spending 17, 18, 19%. So we're pretty good in the efficiency of our health systems. But there are signs that it's time for a review. And indeed, healthcare has changed. You know, our population's getting older. Some of the things we can offer are much more complex and higher costs. And so I think we do need to look at how we can make sure our system lives up to our expectations in terms of universal access in an equitable manner to healthcare.
Mike, you touched on, as you said, that important committee report that was done 5 years ago, and I think you were deputy chair at the time, the New Frontier Delivering Better Health for All Australians. It contained 35 recommendations, and they have been responded to. But out of that report, because I think it was such a seminal report at the time, what needs to happen next then, given this live discussion around access to new medications, the impact of the MFN policy out of the United States, and obviously we're seeing here in Australia companies basically saying, well, is Australia a place we now want to bring new medications because we're not just going to get the return that we need to make it viable. But what importantly, I think, what does that mean for patients?
Well, look, I understand that there is a campaign happening at the moment with some of the multinational pharmaceutical companies trying to put the pressure on Australia, and I understand why. Most favoured nation status from the United States is part of that. I think also there's been a rise in the middle class in places like Southeast Asia and China and India, who put demands on the system as well, and they want access to higher level 21st century medications. So Australia is sometimes seen as not as being as influential as it may have been. I think that's wrong. I think we're still a pretty good market for those medications. I think we have good health systems. We can do very good clinical trials. But other countries are catching up on us. So there is pressure on us to improve our system, both in terms of time it takes to get approval for some of these new medications and in terms of remuneration. I still think the PBS system and PBAC are the best ways to do that, but we need to also be realistic about improvements to the system, which has already improved quite a lot. And I know that people are waiting with bated breath for the HTA review and the implications of that, and that's very important. I think the Health Minister has put the right processes in part to have that happen in the near future, and I'm waiting with bated breath as well to see that process be completed. So I know what is happening. I understand some of the wants of the pharmaceutical companies, and I think we can reach agreement about how we do things about that over the coming weeks and months. But it is clear that it is a market that there are other countries that want to be part of as well, and Australia is a relatively small part of the world market, albeit a very good one medically. So I think we will get there. I understand the complaints, and I understand that we do really need to improve our process. I also think we need to learn from other countries with some of the newer genetically targeted medications and the new biologics. We need to somehow have a way of approving their use and getting them used, very much like the NICE program they have in Great Britain, where they can get approval and start using them before final remuneration is agreed to. And I think that's an important way of speeding the system up. But we need to think in innovative ways. I think we do need to hurry up with our review and get things done pretty quickly.
Mike, we have a question here from Kieran. Do you have a view on the seemingly deteriorating relationship between doctors and pharmacy over prescribing rights and how this will play out?
Well, yes, I do have a view. I think that obviously there's pressure from pharmacy to increase their prescribing rights. I think that we need to examine each and every case in pretty high detail, but I actually think it's important that pharmacists can prescribe in some situations, and I think case in point being asthma management, and I think that we do need to make sure people can get access to medications when they need to. Common complaint I have at the moment in my electorate is people, when they want to see a GP, the waiting times are so long. People often having to present to hospital emergency departments because they can't get in to see their GP, be it a prescription for asthma medication or treatment of a upper respiratory tract infection or something like that. So we do need to broaden our outlook. My view has always been that medicine is a team sport, and that we need to use each of the players in the health market to the maximum capability, and including nurses and pharmacists and allied health personnel. I do think some of the pharmacists' claims and wants are a little bit unrealistic and a little bit outside their scope, and I think they need to be examined closely. But I have been in favour of some pharmacists being able to prescribe, just because access to healthcare is important. We're seeing many country towns can't get access to a GP; they rely on their pharmacies. Many people in aged care struggle to get GPs into aged care. So I think using everyone to their maximum scope of practice is a really important thing. I'd like to see more nurse prescribing in rural and regional areas, for example. I'd like to see pharmacists be more available for immunisations. I think that's been a great change and a very positive one. And I think people need to feel a little bit less threatened in some of these, arguments, both pharmacists and doctors. We can all work together to deliver better healthcare to people.
Dr. Mike, I had a question put to me from someone who couldn't make it today, and I'll pose it to you. Basically, it goes to the point, would Australia ever look to pay for performance when it comes to new medications? Because we know, obviously, with risk share agreements between the government via the department and a sponsor, if there's a budget spend over or it's estimated, then, that's rebated, and that's a whole nother debate. But do you see a day where the government would pay for performance when it comes to new medications entering Australia?
I think it's a dangerous road to go down, because who makes that judgment and how you make that judgment, I think, can be quite complicated. I think we have a very good TGA and payback process, and I'd like to see that continue, of weighing up efficacy versus risks and costs. And I think we have a pretty good system that way. I think there are ways we can make this system more efficient and speed up. This is particularly true in the paediatric space, where sometimes data is difficult to find, and actual performance may be more obvious a long time down the track. So I think, no, I don't want to have that system introduced, even though I know there may be some short-term pressures to do that. I think our system serves us very well, but we do need to continually update a system. Yeah.
Yeah. One more question in the space and we'll move on. Mike, you sort of touched on it. We know in terms of medical devices, pharmaceuticals, amazing innovation. And we're also seeing the increasing intersection between the need for both an MSAC and a PBAC approval. And obviously concerns that the system is falling behind, which means therefore patients getting access to some of these innovative therapies, which might be combined with medical technology or vice versa. What's your thoughts on that?
Well, again, this is a very, very complicated space. I think that the complexities of modern care, and by the way, I think it's a great time to be involved in healthcare now, because we can do things now that we never dreamt possible. But some of the treatments we're using, for example, the CAR T treatments for advanced lymphoma and other treatments now, are unbelievably effective and unbelievably good. But they require a combination of medical input, public hospital, and judgments made about the cost versus the benefits of these treatments. And it's a really complicated space. We need to make sure that we do get access to these new treatments, and we need to work out the most efficient ways of providing them. Medical technology as well in that space. We've seen a lot of innovations in the cardiac space, where we can do valve replacements without needing open heart surgery, without chest splitting, which is a huge advance. You spend a day in hospital instead of a week in hospital, and then weeks and weeks of rehabilitation afterwards. So we can do some amazing things, and we need to get access to those treatments as quickly as possible. But I do think we need to be very conscious of all our health systems working together on this. And that's one of the problems we have in Australia, with a federated system and state and federal health responsibilities, that we're getting a little bit better at dealing with, but we need to improve it a lot.
Mike, before we move on to the next topic, we have a question from Edward, who asks, emerging models of care and telehealth are unlocking access to care for people who may otherwise be unable to access care. What place do you see for emerging models of care and telehealth, both now and into the future?
Well, that's a huge benefit and a huge field. As I said, we with the health committee, we're looking at access to specialists, and that's particularly difficult in thin markets, in rural and regional areas in particular. And the use of telehealth can expand access a lot, but we need to be working out how we do that, and how we use case conferencing abilities, where all the people involved in care can meet together, including the patient. It needs to be patient-led. It's what the patients want. I think there's room to expand what we can do further by getting better engagement of both our primary care providers, our GPs and our nurse practitioners and specialists. And I think we need to look at how we can expand that. And I've spoken to the College of GPs and College of Physicians and College of Psychiatrists as well about expanding access to doctor consultations being available online. I think we need to formalise that and pay for it properly. And I think how we deliver that more complex care, particularly in rural and regional areas, is going to need a lot of digital access and telehealth to do that, for sure.
That's a good segue into the next question I've just got here, Mike, from Andrew. He says, at one stage, you were considering a committee inquiry into digital health access funding. Is that still potentially on the agenda?
Yes.
Easy.
I think there are a whole range of reasons why I think it's worth exploring those options. One of the problems we're facing with the access to specialists is that there has actually been a move of many specialists away from rural and regional areas. And,
Yeah.
how we deliver the 21st century higher level care to those, as I said, thin markets is going to need digital and telehealth input. And there is already a variety of suggestions about how we do that. And I think it's going to be really important. And that's something I would love to do, put on the agenda for our next inquiry after this one.
Thanks, Mike. Sort of, I think this leads in part into the next question then. And Mike, particularly as a practicing specialist, I think it'd be interesting to get some insights. You cannot have a discussion any time these days without the role of artificial intelligence. So as we know, it's moving rapidly into healthcare. So where do you see the greatest opportunities, and what are the risks that governments will need to address?
Yep. Great question. I'm a bit of a troglodyte. I trained a long, long time ago. It's, our medical models have existed now pretty similarly for the last couple of 100 years. But the time has come for change, and we're already seeing AI providing some really important services. For example, we no longer have hospital typists.
Yes. Yes, good point.
AI has taken over that role. It's taken over a big role in medical records and retrieval of data, taken over big roles in research. But importantly, in a couple of areas, AI has also really improved services, and I'm talking about pathology and radiology. And we are already using AI in that situation. We're also using it even in consultations, where we can use AI to generate consultation notes and outcomes and advice about treatment. Now, it needs obviously human oversight, but AI is already upon us in healthcare. It's lost a few jobs, but I think overall it's been for the benefit of the system and delivering better and more efficient care. So I'm not frightened about AI. I think AI has the potential to dramatically improve. In the imaging field, it's already improving our reporting. It's already improving accuracy of reporting and offering even more potential for our imaging technology. In pathology also as well, AI's had a huge role now in our pathology testing and accuracy. So I think, really we should be welcoming AI. We shouldn't be frightened.
No, thanks. As I said, it's certainly not going to be going anywhere. If anything, it's going to be more entrenched.
Yeah.
Another question for you, Mike. Rebecca asks, where do you see specialty pharmaceuticals, i.e., medicinal cannabis, psychedelics, etc., headed, given the current regulatory focus?
Yeah, well, I've actually just met with the National Cannabis Council. So we were talking about where should things go from here, and I think we've had a very large increase in the number of prescriptions written for medicinal cannabis. I'm not sure it has been as appropriate as it should be, and I think there have been some complications of that. I think we need, when we see regulation, a couple of things we do need. We need to make sure that people that benefit by medicinal cannabis can get access to it. It's a complicated field because prescribing of medicinal cannabis is not just prescribing one medication, it's probably prescribing a whole lot of things that we don't even know the side effects of. I think there needs to be more science in the oversight of that and more research. And I think there needs to be a better regulatory structure before we can think about even PBS listing of some forms of medicinal cannabis. I think there's been a lot of hype talked about medicinal cannabis. I think whilst there's no doubt some people can derive benefit from medicinal cannabis, but I don't think it's in the numbers that were touted originally. there is concern, I know, about the risk of medicinal cannabis and possible increases of people presenting with psychosis. It's hard to get data about that, and I think we need to get better data about what happens to people who use medicinal cannabis. And I also think for people that really can benefit by it, and I think in things like oncology, etc., um, I think people can get a lot of help, and we need to make it less expensive and more accessible for people in that kind of regard.
Absolutely. Mike, in the time we have less, a couple more questions. Aged care. So aged care reform has been underway now for several years, and obviously flowed from the Royal Commission report from a number of years ago.
10 years.
10 years, yeah. Reform takes time, as we know. So in your view, has it delivered the improvements that older Australians were promised, or is there still a long way to go?
Do you want an honest answer?
Please. That's it. Absolutely, Mike. I don't want you fibbing.
Yeah, I think there's a long way to go.
Yeah.
And I say that based on the contacts my political office is having with older people and their families.
Yeah.
I think we've had a long time of neglect, and it's going to take a while to catch up. We, of course, have a problem in southwest Sydney, where I'm based, with many people in hospital beds who will be better placed in aged care facilities, or even getting in-home aged care support. We have long waiting lists for placement in aged care facilities. We have real difficulties with getting people with high needs aged care problems, such as dementia and multi-organ medical problems, getting them places in residential aged care. And we are struggling to get some of our aged care providers to build new facilities. We also have workforce issues about at-home aged care, getting providers to provide adequate in-home aged care. And unfortunately, we're also struggling to get some of my medical colleagues to provide GP support in aged care environments. So there's still a lot of problems. We're working on it slowly, and we are slowly getting there, but it is something that we need to put a lot of resources into financially and otherwise to make it to a level that I think is acceptable. And some of the stories we hear are really quite sad, and I think we could communicate a lot better to people, older Australians as well.
Yeah. Mike, final question, because I know you've had a busy day. As I said at the beginning, you are one of the unique members of Parliament, given that you have decades of experience as a health medico, and still maybe work in the field today out there in Western Sydney. So with that background, the key leadership role you have. So if you could leave Australia's healthcare system in a stronger position 10 years from now, what would success look like?
Look, I think success would look like our public hospitals really providing high-level care for the people that needed it, and not having long waiting lists for services, including outpatient services, not having long waiting lists for necessary but so-called elective surgery, and would also leave our primary care providers, be they nurses or doctors or allied health professionals, feeling that they've got adequate resources to provide the best possible care. And it would leave every person in Australia feeling that they could access that care. Because at the moment, many people feel that they cannot access the care that they need.
No, thanks, Dr. Mike. I think no one could disagree with that. That brings to the end the session with Dr. Mike in the series of Jody Talks Politics. So thank you everybody for joining in. I really do appreciate it. As I said, this will be up online in the next couple of days on my YouTube channel. Plus, we'll do some snippet posts of what Dr. Mike said today. So thank you to everybody, Dr. Mike, and I look forward to seeing you again.